Getting outside and taking a walk is one of the simple pleasures of life. But if you suffer with a bunion, you know how painful just taking a few steps can be. Sinai-Grace podiatrist Dr. Hussein tells us how bunions can be treated.
Bunions are basically an abnormal alignment of the big toe. So most people will see a knot on the side of their big toe, and that's basically, to the average person, that's what they consider a bunion. Now, you can have a bunion and live comfortably with it as long as you wear accommodative shoes. But other than that, if you have any type of discomfort where motion of the big toe is painful for them, then there are some options out there as far as what can be done. Not all of them have to be surgical. There are a number of conservative options available to help alleviate the pain. But ultimately, if you fail conservative options, there are some viable surgical options out there that are not necessarily requiring an extensive time off their feet. Conservative options would entail, number one, wearing accommodative shoes, so making sure that the shoes are wide. Now, a lot of people will make mistakes. They'll buy a bigger shoe to fit the width, but then the foot becomes very sloppy inside. So we advocate getting the right length as well as the right width as far as proper fit. Sometimes we'll recommend patients get stiffer shoes if they in particular have pain with motion of the big toe. A stiffer shoe can alleviate that because it won't require as much bending of the big toe. Other than that, arch supports will not really help a whole lot. It's mainly shoe gear as far as conservative options go. Surgery is a viable option for bunions. A lot of people are concerned because it may entail a long time period having to stay off their foot, and that's not necessarily the case. Depending on the severity of the bunion will dictate what type of treatment options are given. There are some where you are walking right away and don't require any type of implantation of any kind. Others require patients to stay off the foot for almost 2 months, and they're on crutches and they're still mobile, but they're limited in what they can do. So the range is there as far as treatment options go. If someone comes in sooner with these symptoms, we can opt to go with a less invasive or less debilitating surgery rather than something that requires extensive time staying off their feet. We don't advocate that someone take pain medications or long-term anti-inflammatory medications for treatment of this, because that's not really addressing the main problem. This is a structural problem. If it goes beyond the ability of conservative care to manage the symptoms, then we usually advocate surgery as a last option.